on Facebook and other platforms.
Okay, great.
Yeah.
Great.
Perfect. So, sir, we're going live in about one, two. Yes, we are live now. Good afternoon, everyone. I'm Saurabh, founder and CEO of Lybrate GoodMD, and welcome to GoodMD Connect Live series. Today, we are going to have a live session with Dr. Naresh Trehan, the top cardiovascular and cardiothoracic surgeon in India. Dr. Naresh Trehan is the chairman and managing director and chief cardiac surgeon of Medanta-The MediCity, a 1,500-bedded multi-speciality institute which offers cutting-edge technology and state-of-art treatment facilities at an affordable cost. Dr. Trehan also founded the Escorts Heart Institute and Research Center, where he was the executive director. Escorts was conceptualized, created, and managed by Dr. Trehan from November 1987 to May 2007. As you would already know, Dr. Naresh Trehan has also received many prestigious awards, including the Padma Shri and the Padma Bhushan Award presented by the Government of India. Without further ado, welcome Dr. Trehan.
Thank you. Glad to be here.
It's a pleasure to have Dr. Trehan with us. Today, when the world is grappling with the deadly coronavirus, doctors are at the biggest risk of contracting this virus. So, today, we'll be discussing some of the most important queries of yours with Dr. Trehan and help you stay safe while helping India emerge victorious against this virus. So, Dr. Trehan, I would like to start with, with very basic question that, many doctors have is what are the symptoms that, they should look for in a patient when they are seeing patients in their OPDs?
So now we are in a triple jeopardy. One is that as we have all heard, that more and more patients are actually contacting the disease but not showing any symptoms. So we have silent carriers, and so far the estimate around the world is that maybe up to 80% of the people who get infected will either show no symptoms or very mild symptoms like a common cough and cold. So you need to divide up these people. One, how do we actually protect ourselves and protect those who have got infected but are not showing any symptoms? So, one, of course, you may discover it by contact tracing, that you have been exposed and somebody by mandatory by law, or you yourself go and get yourself tested because you were in contact with somebody who got it. That's one way of finding out. The other way of finding out is that you do have the mild symptoms and you happen to go to a physician, and a physician examines you and sees that yes, your symptoms are out of proportion to a common cough and cold. Like people say they have severe throat irritation or pain. They don't show so much cough and cold, but they show more signs of this, or their lungs look congested, which they are not aware of on listening to their lungs, you find out. So then if you suspect, then you go ahead and get it done. And I think the index of suspicion should be low, because if you have access to getting checked out by tested by PCR, that's the one way to go. So if then it is obvious that somebody's got the fever, the triad of fever, cough, cold, and like I said, the throat is an important part of it, or you're seeing congestion in the lungs, then most definitely they should be checked out. Now, so how do you protect yourself from these three situations? So universally today, you should not see a patient where the patient is not wearing a three-layer mask or where you are not wearing a three-layer mask. They should be screened outside your office, by whoever staff who is actually also masked, history taken, and try to maintain the distance in your office. So, like I do, I make them sit on a sofa which is about 6-8 feet away from me, and I deal with them from there. And they've already been examined for any other ECG or echo and all that has been done. So I can read all the reports, and where I need to listen to their chest, I do. But the basic thing is to make sure they don't have a cough and cold. Okay. Then the point is that you have already sanitized them as their hands are sanitized. They have the the mask should be fitting well, and then they can be brought in and you see them. Now, the first sign of suspicion, you should get them tested and also ask them to go get tested right away. so that you don't have too long a contact with that. So what it means right now, the estimation is, and there are no 100% proofs to this, that if you are exposed to somebody who has contracted the infection and you are within 3 feet of them for 15-minute contact and you're not wearing a mask, then the possibility is that you are at a high risk of having contracted the infection. Second, if they are wearing a mask and you're not wearing a mask and you're more than 3 feet away, your chances of contacting become low, medium. If both of you are wearing a mask and you are more than 3 feet away, then the chances become minimal. And also the magic number they say is that prolonged contact. So means your contact for 15 minutes or maybe even if 10 minutes you can contract it. So these are the things that you need to know about yourself and your patient to try to stay as safe as possible. This is the office practice. Now, in our OPDs also at Medanta and all other OPDs, we are practicing this very sort of precaution. The other thing you do outside your office is do not give appointments one after the other. Give a gap of whatever time you usually take. To supposing you take 20 minutes to see a patient, then you should give at least half an hour difference and don't let them come into your clinic before their prescribed time. And so you rotate the patient so there is no crowding inside and that you are not overloaded with the burden of too many patients coming in with a viral load. So these are the things you can do for yourself. When you go to the hospital and you are going to see patients who may be suspicious or proven, then you need to get your PPP on. And that means that if they are proven, you need an N95 mask for sure, and your full protection, because there are many models, but as long as they are approved as safe, it's good to do that. The other thing that you need to know is if you are actually taking care of them on a regular basis, then there is some sort of our feeling is today that hydroxychloroquine as a preventive, you may call it, or decreasing the viral load because you're exposed to it. So people who are taking care of COVID patients on a regular basis in a hospital should be on hydroxychloroquine, or people who have somebody with COVID infection in their house and they are taking care of them, they're in house quarantine, then you should be taking the person who's taking care of them closely should take it. So these are the kind of things that are current today. Now, I'm told that there are many Ayush doctors also on the line. So there are research that we are doing with the immune boosters. We are giving it to our patients. There is a 30-patient study going on right now by the ICMR approved study that we are doing. And then just we received a concoction from Sri Sri Ravi Shankar's outfit, and they have supplied us some medicines because we have an open mind that, look, there are remedies out there that can help the body to fight infections and maybe COVID infection also, we don't know. But this randomized trial that we are doing will give us some idea of what are the adjuvant things. So I hope that answers your question on how to protect yourself.
Yeah, I think that definitely does. There is one specific question on that is on the protective equipment. Uh, is it safe to reuse it? What is it, since not many doctors have all the availability of these equipments? Like, at what level they should discard it?
So first, there are two types. Ones that need their one-time use, which should be only used once, and there are multiple use by 5-6 times there are being manufactured that you can sanitize with hypochlorite solution.
Mhm.
You can put them in a tank, you can do many things. We personally, unless it's a necessity, you should not use it now because redo it because you don't know whether you're effectively decontaminating them or not. Now you're talking about these outfits are for people who are taking care of COVID patients, not for your home,
Yes.
not for your own clinic. Okay, so that's why I'm saying that what should you do to protect your family? Okay, the moment you get home from an active clinic, you discard your clothes, send them for a wash, take a shower, change, and then go to the family. This is the best you can do to protect your family. If you develop a cough or cold, in early stage, you feel the raspiness, start wearing a mask at home also. So these are the things you can do. But I personally feel the hospitals are equipped to use multiple use PPEs, not individuals, because to do it at home will be very tough. Now, so if you are in the hospital, it's the responsibility of the hospital to provide you the appropriate PPE.
Got it. Got it. Sir, one more, on that part. Uh, is it? It's a very common question. Maybe the answer is sort of known to many doctors, but some of them have asked is, can I treat the COVID patient at my own clinic?
No, you should not. Your job is to diagnose them and you follow the protocol. The protocol will be one, you refer them to a COVID hospital, report it to the government that you have found somebody who is tested positive, you must report it, otherwise it carries a penalty of even imprisonment. So it's your responsibility to actually first reassure the patient that nothing bad is going to happen to them by reporting, because there is a little stigma to it, but it is for their own protection. Second, there are protocols being developed right now. In fact, from Medanta, we have also recommended, but it's not fully functional yet, is how to isolate yourself at home even when you're positive, how to quarantine, the whole gamut of how to do it. So that is, in today's environment, when the number of cases are not that large in concentrated areas, that there's no need for home quarantine right now, because there are quarantine facilities available with the government, and and they have made arrangements that if you don't want to go to a general facility and you want to go to a private, there are hotels that have been converted into quarantine facilities that can be done. Or you get if you've got symptoms, you might as well get admitted to the hospital, because then if your respiratory status gets suddenly turns bad, then you will not be able to come. By the time you come to the hospital, it would have made you feel worse. So I think that from that point of view, although there is that fear in patients that they to go to a facility and get admitted and all that, they would like to avoid it. But I think that let the rules play the role, not you play the role.
Got it. I think that's a very good insight as to let the rules play the game. But also, sir, you really you mentioned a while ago that how to use disinfect. If you can get a little bit in detail as to, so let's say I'm a doctor, I am doing my OPD. How do I ensure that once the OPD is over, how do I disinfect my clinic? Are there any protocols around that?
So the basic thing is that there is a documented evidence that COVID can live on surfaces. So what are the surfaces that anybody touches or you touch? Basically, you're touching your desk, your where you use your instruments or anything like that, your stethoscope, all these things that are the ones that are exposed. So if you had a patient who is positive, then you have a different protocol. If he was not positive and you just finished your clinic, just wiping all the surface with either alcohol greater than 70% alcohol solution or hypochlorite solution, which is Clorox basically, which is available, that you dilute it and you wipe all the surfaces. So there are two ways of doing it. One, before you start, depending on the length of your clinic, you could take a break and do a second sweep of the surfaces that you're touching all the time. And then after you finish, of course, it should be done. So that's the best way. It's a cheap way of doing it. It's not very expensive, but effective way of doing it. Now, if you have a patient in there who you thought spend a lot of time and you want, then there are hypochlorite sprays available, which you must spray all over the place, just to be, if that's the case, that somebody who was COVID positive, supposing it's one of your staff, you'll have to
Yes.
you have to close down for 24, 48 hours, spray it properly, and then reopen.
Got it. Got it. So I think that's a very good way. But and we talked earlier, sir, about how to keep yourself and your family also safe. You talked about that. People say that their kids don't get that infection easily. They don't get the infection easily. Is it okay for me to sort of as a father, I'm a doctor but I'm a father as well, to come back home and hug my kids, or is it I should be taking precaution myself as well?
Not before you've taken a shower and changed your clothes.
Got it. Got it.
Yeah, I think, this bravado on misinformation, we don't know. We're talking about pets, and everybody was swearing you can't get it from pets. Your pets won't get it. Now today, if the report is right, CNN was reporting 2 cats in New York have turned positive. So I don't know. This is a very wild virus, and all bets are off. So the more careful you are, I see there are two different things. People usually very frequently use the word panic.
Hmm.
Panic is a terrible word. Panic means that you've lost your balance, that the whole society has lost its balance and running helter skelter, not knowing what to do. That's not the state. It is to be taken seriously. And seriously means you do what you can. You have the guidelines available, hand hygiene, masking, distancing. You want to do all those things for everybody's sake, not only your own sake, for your family's sake, for your community's sake, for your patient's sake, for everybody as a national stake, that you do not want to violate certain basic principles. And that is stupid to do it, but people are doing it. Now, what do you do about that? That this is so you can, everything that we do in the next 3 to 6 months will have its perspective. We should all practice it, and then we can emerge successful against this terrible pandemic. So it's an invisible enemy. So you don't have to be so paranoid that you're frozen, but there's no bravado in here. There's no reason to expose your kids to you're coming home from your clinic and then you're your hospital and then you expose them. I think that's a terrible idea. Not only your kids, your own family, your wife, or your parents, especially your parents who are older. So everybody can get it. There are no rules. Initially they said only the older people are dying. Now 40% of the deaths are below 60 years of age, in fact midlife. So don't depend on that. Any data will tell you it's okay. Yes, you try to be careful. There is no how much viral load is needed for it to overcome a human being. That depends on your immunity. If your immunity is good, you're exercising, you're healthy, you're devoid of any comorbidities, your chances of getting less, and if you get it, your chances of getting a milder form are much better. So that's the calibration. But having said all that, I'm not sure even we know, or as much as we know, that there are no surprises in there.
Got it. Uh, since we talked about hydroxychloroquine earlier, some of our doctors want to know what would be the the dosage, the recommended dosage that you would recommend.
So first of all, who are we recommending? That's clear to everybody. 400 milligrams twice for the first day, morning, evening, and then 400 milligrams every week.
Got it. Perfect. Sir, one more thing. One doctor, R. Kumar, has, just now asked. He says 69% are asymptomatic carriers. So should one take the risk of seeing any case in eye clinic, particularly?
If you wear a mask, and that's what I was saying, if you are an ENT doctor, if you are ENT means ear, nose, throat, you have eye doctor where you are exposed to mucous membranes and where you come in touch with fluid from the patients, always wear your gloves and wear an N95 mask. Now, I want to tell you about N95 mask. N95 mask, because it's expensive and it's not readily available, you can reuse it. You can reuse it. There are four protocols of how to reuse it. You can put it if you are an individual. There is a plastic bag. We have 100% alcohol in it. Dip it for 10 minutes, or you can make it 20. Let it dry, and you're okay. So the 3-layer mask. If you're not seeing COVID patients, your 3-layer mask, as we said, If it's a regular surgical mask, you can discard it and do it carefully in an isolated bin. Second, if you're using a cloth mask, which is also effective, three-layer cloth mask is also effective. You get it washed every day. First, it should be put in a soap solution for 45 minutes or an hour, and then let it be, and then dried in the sun if there is sun. So there are many ways, and all this is available even on the net. That there is enough evidence there. But the point is to protect yourself, especially when you think that you're being exposed to fluid, like in anesthetists, when they are intubating somebody, there is aerosol spray. So those are the guys who need full protection.
Got it. Sir, one more thing, as you know, doctors are seeing more patients. Uh, as they see more patients and as they are, locked down in their own clinics and they are also can't travel, they're also feeling and getting this sense of they're getting overwhelmed. So as a doctor, I'm also a human being. How do I, ensure that I take care of myself as well?
So, de-stressing is a very important part of life as it is, but at this time it is much more.
Mhm.
So each one has their own devices, whatever you're fond of. Like I'm fond of Sufi music. Okay, so I'm dying to listen to it, but I don't get the time because of the fact that there is so much happening, so many situations. Because we are making adopting a hospital to make it a COVID hospital in Gurugram. We are doing there's so many things you're involved with that it takes up full time, but then it keeps you busy also, so I don't get time to think. But my personal craving is, can I get to my Bose frame glasses and listen to some Sufi music? But what I find which is very entertaining is playing with the kids, grandchildren. We have grandchildren, and there are a lot of people who have children. So playing with your children, even games remotely, they may be away from you even. Like our grandchildren are away. But we play Ludo, we play guessing games, Antakshari, all this stuff goes on. So it gives you a break and also makes you realize that you're closer to your family today than you ever were. Especially doctors, because we are totally consumed. Even at home, we're always on the phone. Some patient or the other needs you. This is the time where if you get a break, enjoy yourself. I think we'll get busy again, no question. I mean, there's one profession. I mean, people are wondering what's going to happen post COVID. Post COVID, we will be swamped because we have postponed so many things in this lockdown period. People are not. What is the downside of lockdown? Is that patients think that this is elective and then it becomes emergent while waiting. But we've seen so many conditions, especially in my field of heart surgery, the patients who have actually died thinking that they'll wait till they're locked down because they're petrified. So if you get a heart attack at home, there's nothing you can do because you're far away from a good hospital. So there are downsides to it, but overall we'll be very busy as time goes by. But right now the hospitals and doctors are going through a big sort of deficit, uh, especially hospitals where you have fixed costs. The occupancy is 20%, 15%, and the revenues are down to 15-20%. But the fixed costs are very high in operating a hospital. So there are a lot of hardships, but we'll come out ahead and chin up. We are the army. We have to fight. This is our moment.
Got it. Sir, a couple of other questions that have come up live right now. This is from Dr. Abhita Shadri. She says, what do you advise about dentists? Because they say we work predominantly in environment of aerosols. As of now, only emergency extractions are advised. But how soon do you see dental work being allowed?
Well, you remember the time of HIV,
Hmm.
that it created huge havoc in all our lives. And then we learned how to cope with it. So you take the proper precautions, you will treat them. Do not encourage people to come for cosmetic work or that kind of thing. Please don't. That can wait. But for emergency procedures and for dentists and people who are working with aerosol, even more important, in addition to the mask and goggles, they should wear a shield. A shield is very effective to protect you from aerosolization of your other parts of, in the sense if you wear goggles or masks, then those aerosol things can come on that. With the shield, it actually protects it, and the shield can be easily cleaned and reused, so it's not such a big deal. So be careful. That's what I'm saying. You should have goggles. You should have shield if you're going to work inside the mouth. Like I also said about anesthesiologists, also ophthalmologists. So whatever protection you can do is actually, I would say, overprotect yourself. Not a problem, but do it.
Got it. Very nice to hear, sir. Another question, this is coming from Dr. Gulshan Arora. He asked, sir, is there any possibility of developing herd immunity? And if yes, how long it may take?
It takes a long time. Herd immunity is a one methodology. When it happens, it is very desirable, but it takes a long time. Over 60% of the population will have to get infected to get herd immunity. Now, out of those, if you take India, its population, 60% of those, if they get infected, even if 10-15% of them require critical care or hospitalization, there's not enough beds in the world to be able to admit 15% of India's population. So you need to be, this route that we have taken is a very good route. The good route is, one, with the lockdown, there has been a disruption in movement, disruption in interactions. So the chain is broken temporarily. It doesn't mean that it's permanent, but it has delayed the peak if it ever comes. So what in the meantime, in these 4 or 5 weeks, what has happened is, 4 weeks already over, the fifth week we are running, and what has happened is that yes, immunity is also developing in the community in whatever small forms that they are getting exposed. So what happens in the hotspot? So in hotspot, you will see when they, over a period of time, they would have possibly been exposed. Everybody would have been exposed. And that's where they develop immunity, the antibodies to it. So in an artificial way, that is happening already in small pockets. So that helps. Anything will help. It also breaks the chain, and it has delayed the transmission, which is a good thing. Now, in the meantime, we have gotten ready with our medical services also. The enough number of beds, ventilators, PPEs, all that stuff is much, much better than it would have been if we did not lock down 3 weeks ago, 4 weeks ago. So that is one. Second, there is another help that India got, that it has arrived relatively later in the chain. So it's traveled from China, Europe, Southeast Asia, then America, and then it came to India, or in any numbers. And unfortunately, it came from Italy and Iran, but it did. Now, what has happened is that we have 3-4 things that are in our favor. One is that maybe heat will help. Nobody knows, but in the past viral infections, there has been some relief in viral loads. Second, hydroxychloroquine. Now, if it is going to help the people who are taking care of COVID patients, maybe give some protection. Not clear, but there seems to be some benefit to it, and also as a treatment to patients. Third is the fact that the lead drug, which is specific, these are repurposing of drugs that is happening, but remdesivir, which is a drug which is everybody I think has heard about it, is now in advanced stages of phase 3 trial, hoping that the trial will actually end in the next 2-3 weeks. They've also, the company Gilead that is manufacturing it has given substantial quantity to WHO to do a worldwide trial, and India is the lead country in that. And Medanta has also applied that maybe we'll also get to do it, which will tell us how effective it is per se against COVID, and the one that we have in India, that is the same response we'll get from our Indian patient. Third is the fact that are we having a blunted response because of the fact that we have immunity against so many diseases that we live in? And fourth is BCG. Now the question mark about BCG, a large part of our population is immunized against with BCG, against tuberculosis, and that will that help us? So these are all unknowns, but I'm saying whoever it is, and whoever's listening, whoever we speak to, or even for myself, we need to get careful and not look at hopes that may come. If they come, fantastic. The best thing that would happen, it's not a real big peak, it's a blunted response, whether flattening of the curve as they call it. If that happens in India, we'll be able to handle it much better. If it is a milder form, that would be great blessing. If we have enough medication by the time people get sick in large numbers, that will be a blessing. So I think there are many hopes, but let's not pin our hopes on hopes. Let's be ready for the worst. And if it doesn't happen, then we can celebrate. Hopefully, Diwali will be a big celebration.
Got it. I think that's a very nice way of cheering all the doctors. Sir, one other question that has come up is is plasma therapy has recently been utilized as a treatment option. Is that something that can you shed some light on that?
Yeah, so we there are two things. One is plasma means that you take it from a patient who has already suffered the infection and has developed enough antibodies, enough IgG antibodies. You take that serum and you inject it into a patient who is suffering hugely. Hopefully, that the additional antibodies will be able to overcome the viral load. Okay. One thing limitation is that it's not been used enough, and when is the right time to use it? Because this is now on compassionate ground you use it. Compassionate ground means that the person is gone and you're trying to save him. Then so you never really find out the efficacy of that intervention that you do if you do it too late. So now there is enough evidence that it is quasi safe to do it. Maybe we can move up the chain a little bit to say, they don't have to be like collapsing before we give it, but maybe if they're getting sicker, they need a ventilator or pre-ventilator. If we give it, maybe we'll have a better response. There is scientific reasoning to it. So there is a sound basis for doing it, because if they don't create any reaction in the body, like a blood transfusion or anything might do, that can hurt. But otherwise, if that is not the case, we are okay with that. So I think that is one promise that is and more and more people are recovering. So it will become more and more available. And the other thing is stem cell, which the Israelis are talking about, that they have taken mesenchymal cells or whatever cells they're talking about and actually used it in patients effectively. Now, if that's the case also, then those can be replicated very quickly around the world. Remdesivir, plasma, and stem cells. These are the three horizons that we are looking at closely.
Got it. Got it. Sir, another thing, there are a lot of rumors around whether this can be spread through water sources also, and second on airborne, which is to say that through air conditioning as well.
So, it comes back to viral infections or bacterial infections is not unknown through AC systems. If you are young, but when I was in the US, there was a epidemic or not epidemic, contained epidemic of Legionnaire's disease. Legionnaire's disease was named Legionnaire's because it started at a veterans convention, American war veterans, and they were all like a legion, conference or something. And in that, it spread in Philadelphia and affected and killed many people. So that is how the origin of Legionnaire. And people wondered where it came from. Finally, the consensus is that it came from the air conditioner. So somebody had it and then it spread. Now, that is a concern. But whether that has done damage to everybody or not, there are 2-3 incidents around the world which make you suspect that air conditioning was responsible. But it has not spread like to everybody, so in the sense that if it was air conditioning, it would spread much more rapidly. So there are contradicting evidences to it. So I don't know, because it is always any disease that happens has to have a load, whether it's bacterial or viral, that you get enough dosage, and then the host resistance. So it is always that balance that you find which will overcome your body or not overcome your body. So is there enough little bacteria coming down, or viruses coming down from the air conditioning? Very possible, and I may say I'm sure they are. But are they enough to overwhelm you? There is no evidence to that.
Yeah.
Same comes from airborne.
Sir, how long we can hope for a vaccine to be made available? Is it something that is going to come in this year?
Well, if you look at the Oxford group, which has started early, they are saying that they have started human phase one trials. Phase one trials means that they are injecting asymptomatic or clean people and testing what dose and whether it's safe. So that's the phase one, is safety trial. If that turns out they go to phase two and three, they may even compress phase two and go straight to phase three. So it will, at best, they are saying maybe we'll make it available by end of June and to the world by July, August. Very possible. And we are hoping, nobody wants to deny it. We all hope that this is correct news. The rest of the world, there are, though Moderna and Johnson in US have two lead vaccines which have been funded by the US government with $400 million or something. They are also moving, but they think that it won't be ready for 6 months, and then by the time it comes to the market, it will be 8 to 12 months. So hopefully, the British group, which is working, will have early success. Now there are other labs also around the world that are happening. The Chinese are claiming that they are close to it or they have it, but any news coming out of China has to be taken with a bucket of salt. So I think it's better to hold our horses, but there is hope. And I'm saying that India is a latecomer in this whole tragedy, which is a good thing. So maybe we will benefit more than other countries have, because it has devastated so many countries. Anything that can bring Europe and America to its knees means huge impact.
Hmm. Perfect. Sir, another question which has come just now from Dr. Saurav Mukherjee. He's asking, how can we get rid of, you talked about how to get rid yourself about from the by taking a shower and just after seeing patients. But what about currency? Like, what about the currency notes? The Indian rupee. How do we get rid of that? We want that.
After a while, and I should not be the doctor to be saying all this,
Yeah.
where does it stop? The basic thing is, did you touch a package by just touching it 1 minute and between two fingers? Is it overwhelming you? I doubt very much. There is no evidence that it comes from notes, newspapers, home delivery. These are all, we don't know. And we are saying, there's a pizza delivery is bad. If you take precautions, it's not. So the people who are preparing it are sanitizing everything. They sanitize their hands, wear gloves, wear double mask before they come to your door, and you wear a mask before you receive anything. And you have no contact. You're not hugging somebody who's delivering you a pizza or any home delivery. I don't think that. So you can take the package, discard the envelope immediately, and wipe out the. So you can take precautions like alcohol sponges and all that you can do. But nobody has really said that. Look, this is the quantum that is residing on a newspaper, and you touch a newspaper and you touch your nose or your mouth, and you're going to be infected. So, but like I said, doesn't matter. You are on the cautious side of things. So do as much as you can. And then it may be that everybody will get some form of it. We don't know. The way it's going, it'll keep going. It may come back like it has come back in some countries. So either herd immunity will take place, or vaccine will come to our rescue, and 90% of the people or more will will get mild infection or a little bit of infection and then get better, and maybe 2-3% will lose. But otherwise, we are hoping that India may have better statistics than the rest of the world, because we are latecomers in this.
Got it. Sir, on that note, there is another question that has come up. There has been research on developing immunity once you have contracted the virus. There an antibody test that has come up or is going to come up, and there have been contradictory reports, especially coming from China and other places, that people are contracting the disease again after having been treated.
There is reports from Korea also, Japan also.
Yeah.
So we don't know. See, when it happens to a small number of people, we don't know what their circumstances were.
Mhm.
We have seen in patients, even while they're in the hospital, they turn negative and then they turn positive again.
Yeah.
So, what is the quantum of antibodies, that's the IgG, which stays in your body for long periods of time? What is your how much IgG did you antibodies did you develop in your blood? If you had enough load and which would fight any little viruses flying around and then neutralize them, it's okay. But there are some people who didn't develop enough of a immunity and then they got resurgence. So these things can happen. But is it a rule? We'll only find out with time. And the fact that we need to do enough studies to see that when somebody has recovered, do they have IgG antibodies in them, and what happened, whether they got exposed again or what happened, we don't know, and what is their background. So I don't think enough has happened. Japan has had to lock down again, I mean, declare emergency in some areas. South Korea has had to do that. So I don't think you can close your eyes to it and think that, like some of the other, like measles and all that, if you get, you rarely will get measles again once you've got it. But is it the same immunity in this virus? All bets are off because it's a crazy situation. Nobody knows what the hell this is. The only thing that we know, it's a very resilient virus and that it spreads like crazy. That we know.
Got it. Sir, one last question. I know you are in a hurry and you have to leave now in another 5 minutes. So I was just wondering one last question. There's this, in India, and immunity is playing a great role, as we discussed earlier as well, and you mentioned. So Dr. Geeta Arora is, asking us, what is your opinion on, Ayurveda and homeopathic, medicines helping to raise immunity in particular, and whether you think an overall approach of integrative approach is something that should be applied here?
Most definitely. I am the flag bearer of the belief that traditional medicine has huge strength in it, which unfortunately has never been standardized properly so that the world can accept it. And in addition to that, there has been this whole heavy metal use in Ayurveda, which is a dicey business because if you want to use heavy metals, in the ancient times they used to bury the stuff with like mercury into the ground at 400 degrees centigrade or something like that, and it would become amorphous. It would not be a metal anymore. But for production, I mean, people have done all sorts of stupid things and got a bad name to lead and mercury and all that stuff. So I think Ayurveda formulations, that means herbal formulations devoid of metal, are safe. They have a role to play because they kept the world going. India kept going for thousands of years, and so did traditional Chinese medicine. So if you look at it, I'm sure there are many remedies in there, and like I said, we are testing some to see that what is the principle. Modern medicine works from outside in. They say, you got a problem, let me give you something which is mostly a poison, whether antibiotics or a chemotherapy or surgery or radiation. These are the three things that we know really. It is effective, very invasive, very expensive. We ignore the body completely. Whereas all traditional medicines only strengthen the body to fight the disease because they don't have radiation, they don't have many surgical procedures. So thank God for that. So if we can use the immune boosters or from traditional medicine and whatever we can use from the outside from modern medicine, that powerful the combination would be hugely powerful, like an army and air force. But there is a lot of research required. There is very little documentation. There are good people working on it. I was on a call yesterday with Dr. Darshan from Bangalore, who has got this hospital he's made, and he's doing some research. We want to collaborate with him. He's done the pharmacopoeia on 5,000 herbs. So a lot of work is there, but it's not become to a complete ecosystem yet. And I think we should, if we want to, really, we should bring it into like a front stage very quickly. And there are lots of good things in there. So I'm one of those guys who are at odds with the rest of most of my colleagues, but I'm a believer, as you may have felt.
Thank you, Dr. Trehan, for spending time with us and enlightening doctors around India on how to manage in this difficult time. And we really appreciate you having us with us today.
So right now we don't say bye, we just say stay safe. And
Yes, stay safe and Jai Hind.
stay. Okay.
Bye.
All the best.
Thank you. Bye.
हाँ जी अब क्या छुट्टी है 2 बजे तक